My name is Chloe. I'm a nursing student and I'm ready to do my medication administration checkoff. So I'm in my full College of Nursing dress and this is the room that I'm in. I would start by making sure that my room is a no interruption zone per my agency's policy. So my door is closed. If anybody called me, I would not answer and only talk, having professional conversations that are essential to what I'm doing. Okay, so I would start by comparing my MAR to my patient care order form, just making sure that they're the same. So we've got the right patient, Jaguar J. Jones, Jaguar J. Jones. We've got the right MR number, 4176352, 4176352. Allergies to penicillin, allergies, only penicillin. Okay, and now I'll find the drug. So we've got Novolin R, regular insulin, U100 insulin, Novolin R, regular insulin, U100 insulin. We need 10 units of that drug, 10 units subcutaneously. Subcutaneously is our route. 30 minutes before meals, 30 minutes before meals, is that our time? Okay, and so I do not need this anymore, I've checked. Get rid of that. And now I'm going to do our first check of accuracy. I'm going to perform hand hygiene before I do this. So I'm going to start by making sure we have the right patient, Jaguar J. Jones. The MR number is 4176352 and still allergy to penicillin. We need Novolin R, regular insulin, U100 insulin. So let's see, I've got Novolin R, regular insulin, U100 insulin, and I'll show you that. And it is not expired. As you can see, the expiration date, not expired. Okay, perfect. So we've got the right drug. Now we're going to need 10 units subcutaneously. So I'm going to grab an insulin needle, and this is just the perfect needle for subcutaneous injection. So the right route. I'm going to need 10 units. So I'm just going to start by opening an alcohol pad and cleaning the top of my drug. And the lid was already off. Sorry, can't get it out. There we go. So I'm going to clean this from the inside out, and I'm done with that. Now I can open my needle out. That's in the trash. And first I'm going to inject 10 units of air. Okay, so I injected 10 units of air, and I can expose the needle and inject it into my drug here. And I'm just injecting that and then flipping it upside down. Make sure I can see the 10 and injecting some of the medication, making sure there's no bubbles. Okay, and make sure I got it right at 10 where it needs to be. Okay, it's right at 10, so now I can put that down, and I will put up the safety so that I don't injure myself or anything. Okay, so we've got 10 units, and I'll just show you that 10 units and no major air bubbles. And we've got 10 units, 10 units. And this is a subcutaneous needle, so we have the right route. 30 minutes before meals, it is 30 minutes before his meal, or it's almost, so he needs his medication. And it's not been indicated that he has done it, or has gotten it done. He more than likely needs insulin for his diabetes, so that is the indication. He hasn't had it yet. And the right documentation, it is all elements of a legal prescription are included here. All right, so now I can do my second check of accuracy. So I will make sure we have the right patient still, Jaguar J. Jones, allergies penicillin, and the MR number is 4176352. So now let's make sure we still have Novolin R. So we've got Novolin R, regular insulin, U100, Novolin R, regular insulin, U100 insulin. Okay, and we're gonna need 10 units. So we've got 10 units subcutaneously. We have the right needle for subcutaneously. 30 minutes before meals. It is 30 minutes before his meal. So we're at the right time, and nobody has done it for him yet. And more than likely has diabetes, so that's why we're giving him insulin, and he needs it. So all elements of a legal prescription are included here, and I'm going to write my label now. So I'm just going to get a piece of tape out and write out my label. So first you do the name, so we need Jaguar J. Jones. We're going to need Novolin R regular insulin, U100 insulin, so Novolin R U100 insulin, and 10 units is the amount of the dose units. Okay, so I've made my label, and I'm just going to be placing this on my syringe, not wanting to cover up anything so that I can watch the amount come out. All right, so I've got that ready. Now I'm going to take this and my MAR, my drug, and an alcohol pad to my room. Okay, I made it to my room. First, I'm going to start by performing hand hygiene once I've entered the room and placed my things down. I'm going to explain the procedure to the patient. So I'm just going to be giving you your insulin, sir. So I'm going to be able to pick a spot here. I'm going to pick the abdomen for this subcutaneous injection. But first I'm going to raise the bed, lower the side rail, make sure it's at a comfortable working height. And now I'm going to do my third check of accuracy, and I've already performed hand hygiene. So now I can check. We've got Jaguar Jones Jr., Jaguar J. Jones, and we've got the MR number 4176352, MR number 4176352, and allergies to penicillin. Do you have any other allergies that we need to know of? No? Perfect. Also, whenever I had done my drug, I would have checked with another nurse to make sure that I didn't miscalculate anything, that I had done the right amount. If I had done some calculations, I definitely would have checked with her too, but I did not do any calculations, so we're good on that. So I also would have done my pre-administration assessments on him, depending on the kind of drug and if we needed that. Okay, so we did the allergies. Now we're going to make sure that we've got the right drug still. So we did Novolin R regular insulin U100, Novolin R regular insulin U100 insulin. We needed 10 units subcutaneously, so we've got 10 units on our syringe subcutaneously. It's the right needle for subcutaneously, and it still says his name, Novolin. 10 units, 10 units. We needed 10 units, and I can see that I've got 10 units here. And then 30 minutes before meals. It is 30 minutes before his meal, and nobody has given it to him. I see right here on my paper. So the right indication, so just make sure that, well, more than likely he had diabetes, so we want to give him his insulin that is needed. And so all elements of a legal prescription are included here. So I am ready to perform, I'm just ready to give him his injection. So I've already exposed my area. I'm going to put on my gloves. And again, I've already got my sharps container. I've got everything set up. Okay, so I've exposed the area, and I'm just observing, making sure there's no bruising, edema, swelling. We don't want any signs of inflammation or infection. And so then I'm going to palpate the area, and I don't feel any masses or just anything that would make me not want to give him the injection there. Okay, so now I can wipe the area with my alcohol wipe. And I'm just going to wipe from the middle out, so where I'm going to inject, out, and I'm going to point to where I'm going to give him this injection. So I'm going to remove our safety here, okay, and I'm going to pinch, making sure I've got enough room, and it's just going to be a little pinch, sir, and slowly injecting, and remove it, and it's going straight into the sharps container, and I'm just doing some gentle but firm pressure. Okay, and I'm doing some gentle firm pressure so I can throw this away, and I would lower his bed, raise up the side rail again, remove my gloves, doing it the proper way, so no sterility is broken. Okay, so I've done everything for your procedure. I'm just gonna make you comfortable. I already set up the bed. I'm going to make sure you don't have any allergic reaction. I'll definitely come back within 15 minutes to check on you, make sure nothing's wrong. And I will also go and record my documentation in the MAR at the nurse's station. So that is all.